The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above gain, driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above gain. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. The Philippine College of Physicians is unstoppable, implying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable, implying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable, implying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians. The Philippine College of Physicians is unstoppable, implying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable.
Our dear Almighty Father, we express our sincere gratitude for the gift of another day. We ask forgiveness for our sins, for which we lay our regrets and sorrows. Thank you for your overflowing and unending patience, kindness, and love that you shower us every day of our lives. Today, as we gather for this special event, we humbly seek your divine providence to help us share your grace to others. Help us engage in meaningful discussions by giving us wisdom, understanding, and guidance. Help us learn and grow and love one another so that we can become better children of yours. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, helas ng silanganan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, kuya ka ng magiting, sa manlulupin, di ka pasisingil, sa nagagapulog sa simoy at sa langit mo bangaw, ay tinatang tulakaw, shall be the light and lead a path to wisdom, our will to be our might. To those in vain and suffering, we shall hear a call with arms to care and comfort, compassion above all, to face a brighter future, bound in unity. The Philippine College of Physicians, we shall be, hand in hand, building a stronger nation. Panatang Karangalan ng PCP. Bilang isang tapat na manggagamot PCP, ipinapangako ko na magpapamalas ako ng kabutihan at katapatan sa isip, sa salita at sa gawa. Pangangalagaan ko ang dignidad ng aking propesyon sa lahat ng pagkakataon. Gagalangin ko ang mga kapwa ko manggagamot, kapwa manggagawang pangkalusugan, at iba pang may kinalaman sa aking gawain. Sa wastong pamamaraan lamang ako makikitungo sa mga sanay o industriyang pangkalusugan. Hindi ko pagsasamantalahan ang ugnayang ito at hindi ko ito gagamitin sa pansariling pakinabang. Paninindigan ko ang katapatan at katotohanan at higit sa lahat, uunahin ko ang kapakanan at kabutihan ng aking mga pasyente sa lahat ng pagkakataon.
So good afternoon, everyone. Good afternoon to our colleagues, guests, and of course our guest speaker for this afternoon. Upon the signing of the Universal Healthcare, or better known as your Republic Act 11223 in February of 2019, and now on its fourth year of implementation, still in spite the different activities of the Universal Health Committee of the PCP, in spite our caravans with other chapters, there are still remaining questions inside the minds of our members at the Philippine College of Physicians. That's why activities like this is being done in order for us to have a clearer picture of this new health system that is ongoing. Actually, I have asked some of the implementers of this new system. Allegedly, it's on phase 2, actually phase 1, 2, and 3, and now on its phase 2 of implementation. But mostly, these are a government sector. So hopefully, this afternoon, we can have a grasp of a better understanding of this new health system, the new law, the Universal Healthcare Law, with our invited guests. And to start with our activity for this afternoon, may I introduce to you our regent at the Universal Healthcare Committee to give us the welcome remarks. So our regent is Dr. Regina Burba, an incumbent member of the PCP Board of Regents, Professor 1 of the University of the Philippines, Philippine General Hospital, Associate Clinical Professor 4 of the said hospital, also a Clinical Associate Professor of the same institution, Division Chief of the Division of Adult Medicine, Department of Medicine of PGH, and chair both of the Hospital Infection Control and Antimicrobial Stewardship Committee. Also, she is head of the UP Prime TB Dots of the same hospital, member of the COVID Crisis Committee of the PGH, and a medical specialist 3 of the same hospital. Please welcome our regent of the Universal Health Committee to give us the opening remarks, Dr. Regina P. Berba.
Greetings, everybody. I'm thrilled and honored to have been given this task to welcome all our colleagues, especially our PCP members, the leaders of internal medicine in our country, both general internists and subspecialists. I also want to welcome our dear guests from other specialists. Thank you for logging in and joining us. Universal healthcare is a very, very important topic and will be very relevant to all of us, regardless of where and what medicine you practice. So I am glad for all of us to be part of this learning activity this afternoon. Emphasize ko po that this is not just another UHC lecture, but actually, I think it's a very invaluable and timely one as we are all preparing for the dramatic but wonderful change that will soon happen to our healthcare delivery and financing system. So thank you to our distinguished lecturer for taking the time to share with us her expertise on the ABCs of the UHC. Today, we hope to listen to a discussion and become more enlightened with the basics of the universal healthcare law. At the end of the talk, there will be a lot of time for your questions as well as your issues, anxieties, and fears, which really all should be aired and heard. But wait, there's more. Learning about UHC does not end with tonight's lecture. In fact, it's a prelude to another great event. So watch out for the announcement of the summit coming your way on March 25. Kaagad-agad na po ito. Sa Sabado, just a few days away. So big time po, no? The PCP, as you all know, is celebrating its 70th year. And this very extensive series of learningful events and summits are part of our grand celebration. So, in behalf of the Board of Regents of the Philippine College of Physicians, led by our President, Dr. Diana Payawal, as well as the ever-dynamic and always on top of the situation PCP Committee on the UHC, led by Dr. Dax Ronald Librado, I welcome you all to this meeting of minds and common visions. This lecture comes to herald our new hope for a better health for our Filipino people. Again, welcome, and we all look forward to a very productive webinar for all of us tonight. Thank you.
So thank you very much, Dr. Nina, for that message. Actually, Dr. Nina is very active and very supportive with the committee. And to help us with to moderate the session for this afternoon is my co-host. She is also a member of the Universal Health Committee of the Philippine College of Physicians and also a board of trustees of the Philippine Society of General Internal Medicine. Please welcome to moderate our session for this afternoon, Dr. Carmela Rosan Remotigue.
Thank you, Dr. Punong Bayan, and welcome everybody to this afternoon's activity. As mentioned, our webinar is a prelude to this coming Saturday's UHC Summit, which is headed by the Pre-Con Organizing Chair, Dr. Grace Nilo, who is also in attendance today. So our speaker this afternoon, who will give us the basics of the UHC law, is the Division Chief of the Career Development and Management Division of the Health Human Resource Development Bureau of the Department of Health. So let us welcome Dr. Quen Dayan Raagas.
Good afternoon. Allow me to acknowledge the presence of the President of the Philippine College of Physicians, Dr. Diana Alcantara Payawal, the Vice President of the PCP, Dr. Ronjin Solante, PCP UHC champion, Dr. Regina Barba, and the PCP UHC advisor, Dr. Imelda Mateo. To all our colleagues and participants in the Zoom and Facebook Live, a pleasant afternoon to all of you. I am Quinira Agas, and I'm honored to present the ABCs of the UHC in the perspective of the Human Resource Development Bureau. Outlined here are the objectives of my presentation as shown. To start the ball rolling, let me share with you an overview of the Universal Healthcare Law. Okay, so the UHC Act was officially signed by former President Rodrigo Roa Duterte on February 2019. This was followed by the signing of the IRR, or what we call the Implementing Rules and Guidelines, by the former Secretary of Health, Francisco Duque III, on October 10, 2019. So in a nutshell, the UHC Act, or the law, paves the way for the Philippines to embark on a major health reform. That's under the leadership of the Department of Health and the Philippine Health Insurance Corporation, or the PhilHealth. So these major health reforms include the organization of the health system into healthcare provider network, or what we call the HCPN, which is composed of primary, secondary, and tertiary levels of care, wherein the primary care serve as the navigator of the health services within the network. Second major reform under this law is the classification of health services into two major groups. Okay, so we have the healthcare packages consisting of the population-based and the individual-based health services. So the third major reform under this law is there's health financing mechanism simplification, wherein the population-based health services will be generally supported or shouldered by the tax-based financing, while the individual-based health services will be largely financed through the premium-based social health insurance. So that's the financing scheme of this new law. And so upon its signing in 2019, several advancements and measures have been initiated and enacted by the government and health actors in line with the aspirations of this universal health care. So this act is guided by the four key principles that the Philippines as a nation adopt. So first, we subscribe to the integrated and comprehensive approach wherein we wanted to ensure health literacy, health promotion, healthy living, and protection from hazards and risks. Second, we wanted to have a healthcare model that will provide comprehensive health services. That is emphasizing that we wanted to deliver health service that will diminish or lessen the cost of financial hardship of our kababayan, especially the poor and the marginalized members of our society. So that's the second one. And the third principle is that we wanted that this law will be anchored on whole of society, whole of government approach in the development of the health policies. And lastly, we wanted this slant to be people-oriented. It's centered on the people's needs and also the well-being. Okay, so the law itself hinges on the following objectives. So we have we have this in our UHC IRR, and actually the law, the objective or intent of the law, the policy envisions that this is a realization which is progressive in nature, so incremental, and it should be systematic also. And then we have to do this na clear ang role delineation ng mga stakeholders. So this would result hopefully in greater efficiency and effectiveness of our healthcare system in the Philippines. So at the same time, we wanted to ensure also that there is equitable access of healthcare that is with quality and affordable. This is the main goal of the policy, and this is the policy intent of the UHC law. Thereby, we see that in the future, there would be protection against financial risk. We will lessen out-of-pocket cost eventually. So, as shown in this UHC conceptual framework that we use to assess the attainment of the universal healthcare in the Philippines, our societal outcomes for the universal healthcare is summarized into three. So, one is better and equitable health outcomes. Second, we have a more responsive health system. And we can have financial risk protection. So kasama po tayo doon. Although we are doctors, but we are also patients. So kasama po tayo doon sa beneficiaries ng law na ito. So this will be attained when the 6 outcomes for each health system building block will be in place. That includes social determinants of health. So, eto, first lang po, yung patient-centered care, which can be provided by the healthcare providers, organized as integrated networks. So, that's in the service delivery health system block. And in the health workforce building block of the health system, we wanted to have sufficient, competent and dedicated healthcare workers that will be available for every family. For the health financing building block, we wanted to have sustainable, efficient, and equitable healthcare financing. That's to ensure affordability of health services. For the access to quality medicines and health services, we wanted to have quality essential medicines and technologies. And for the leadership and governance pillar of the health system, what we wanted for the universal health care is to develop good governance and evidence-informed policies. And lastly, for the social determinants of health, we wanted to pursue healthy settings in schools, in the workplace, and in the household. So the main assumption for us, for the Philippines, to achieve universal health care in our context, or well, to be in place in the Philippines, is actually beyond the control of the DOH. And that is where the presence of the whole of society and the whole of government approach takes in. Hence, the DOH is cognizant of this crucial role of the private sector, wherein PMA, medical specialists, medical societies is largely contributing into this endeavor. So, actually, if we try to look at it, mas malaki po ang role ng private sector. And that's where the DOH is banking on to engage the private sector in this endeavor. So we have these strategic objectives in mind, and let us be mindful of the timeline of the UHC Act implementation. So we have here foundational elements in this health reform. So kung nakikita niyo po sa slide, we have 3 major policy timelines, which are the implementation of the managerial and technical integration in 2022, so that's last year up to this year. And then the financial integration, that would be, we're working this year up to sometime in 2025, and hopefully by 2026, there's an issuance of an executive order na mandatory na ang integration as what is specified in the UHC law. So intermediate timelines, we're seeing that we have a partial implementation of the Devolution Transition Plan, or the DTP, from 2022 up to 2023, so at the end of 2023, and with the full devolution in effect by the start of 2024. That is still in accordance with the Supreme Court ruling on the Mandanas-Garcia case, as well as the Executive Order 138 series of 2021. So with this most optimistic outlook, the Universal Healthcare Law implementation should be in place by sometime in 2026. And then we in the DOH have, challenges because as we see it coming, there are temporal events that the country encountered in 2020 and in the coming years, I suppose. And more realistic about it, the implementation of this health reform is by 2029, which will actually be carried over by the next administration, since the present administration will end in 2028. This will be reviewed in 2026 as what is specified in the law. However, currently, the DOH is also rehashing provisions in the UHC law that will be amended possibly within the year or by next year. So with this in the horizon, the DOH released the health sector strategy for 2023 up to 2028, and this amplifies the vision, policy direction, strategic objectives that will be needed to undertake and to implement the universal health care in our countries, as well as we wanted to optimize resources in lieu of the devolution transition plan. And it is embedded in this health sector strategy, or what we call the HSS, that the recognition of health is multifactorial and based on the biopsychosocial lens. There's a need to be more pragmatic about it, and we approach it in a multi-pronged approach targeting the health outcomes. So we can appreciate in this slide that the provision of health services only comprises 20% in addressing health outcomes. So as such, the principles under the Universal Healthcare Law somehow resonates with these implementing guidelines, and the strategy insofar as the whole of society and whole of government approach is required in attaining universal healthcare in our country. And now that we have covered the basics, I think I need to discuss the heart of the universal healthcare, which is primary care, and defined as initial contact, accessible, continuous and comprehensive, as well as coordinated care in all levels. So we wanted to have a accessible healthcare services that includes a wide range of services from all presenting symptoms or conditions, and the ability to coordinate referrals to other healthcare providers and healthcare delivery services or systems whenever it's necessary. So for us to attain universal healthcare, so both primary care and specialized care must be coordinated in such a way that it can be portrayed in this patient flow in the network. So we lift this from the Philippine Health Facility Development Plan 2020 to 2040, and at the minimum, the healthcare provider network, or the HCPN, consists of primary care provider network composed of barangay health stations the primary care facilities, so we have the RHUs, rural health units, and levels 1 and 2 hospitals, as well as level 3 hospitals owned by the LGUs. We also included here ancillary facilities such as the private medical outpatient clinics, standalone birthing homes, infirmaries, standalone laboratories, and dental clinics. So the primary care facility shall serve as the first point of contact of patients and families, as well as communities, with the healthcare system to access basic and primary comprehensive care. So, yung primary care facility, sila po yung unang kakatokan ng mga pasyente. Kakatok, kahit hating gabi, Doc, pwede po bang magpatingin? So, there are places in our country na ganun pa po ang reality ngayon. And, well, if a higher level of care is needed, there will be referral system. So, they will be referred, yung pasyente na yun, from the primary care facility, they will be referred to levels 1 and 2 hospital or level 3 hospital, or a standalone ancillary or specialized facilities within the healthcare provider network. So the level 2 and 3 hospitals will provide the intensive care services and some specialty care services. So from that standpoint of the National Health Workforce Support, the NHWSS, there is an existing physician deployment program that the DOH is implementing. So we augment the workforce needed in both primary care provider network as well as the healthcare provider network. So we have the Doctors of the Barrios program, the DDTB program, and the HRH deployment program, which we deploy physicians and all health professionals, medtech, nurses, midwives, nutritionists, dietitians, physical therapists, pharmacists in the primary care facilities. So, nasa RHU po sila, rural health units, nasa barangay health stations po sila. And for the healthcare provider network, yung HCPM, we also have a post-residency deployment program, the PRDP, which deploys residents from select DOH hospitals and specialization who graduated from the DOH teaching and training hospitals. So we deployed them in priority levels 1 and 2 hospitals for a period of 1 year. And then, in addition to that, this year, we will be implementing the Specialista para sa Bayan program, or the EPSB, wherein the PCP joined the DOH in the consultation of this program and also in the signing of the administrative order in 2022. So these board-certified specialists will be deployed in the Level 2 identified hospitals and Level 1 as well for a period of 2 years. So it's akin to the Doctors of the Barrio program. So you might ask, perhaps, can internists be primary care workers? Kasi yun yung parang bone of contention. Internist po ako. Can I be a primary care worker? So the short answer is yes. Based on our joint administrative order, that's JAO number 2022-001, it is stipulated in the guidelines that this will apply to all physicians, nurses, midwives, and other health professionals that will register. Okay, so duly registered and licensed by the PRC that will provide primary care services will be considered primary care workers. So in the admin order, section 6, letter B, number 2, stipulated that all licensed health professionals interested in applying for certification can register in the PCWIS, or Primary Care Worker Information System. So in a nutshell, this concept is best represented in this four-stage model that's leading us to systematic change. So we have outlined here the steps by which we can achieve our targets and our goals as a country in actually realizing the universal healthcare. So universal healthcare is an approach, but basically yung bottom line natin ay yung tatlo. May financial risk protection, better health outcomes, and responsive yung health system. So walang na hindi natin nasasalo na mga pasyente, and also we wanted to decrease out of pocket cost of our patients. So contextualizing this to know where we are right now, at the policy level, we have enabling policies such as the Universal Healthcare Law. It took us 30 years since the Alma-Ata Declaration. But, well, it's a landmark legislation that the Universal Healthcare Law was enacted in the Philippines in 2019. I think that's the policy window that we have, and it's a major leap in our health sector development. We also have enabling policy, which is the health sector strategy, the joint administrative order for the primary care worker certification, and the Philippine Health Facility Development Plan, as well as the National Human Resource for Health Master Plan, or the NHRH-MP. Hence, what do we want to achieve? Well, we envision first the placement of primary care physicians in the primary care facilities. So that's the aim. You want to saturate PCFs, or primary care facilities, with primary care physicians to serve as gatekeepers, while the medical specialists will be placed in levels of 1, 2, and 3 hospitals. So that's our strategy in order for us to maximize the skill set of the medical specialists and their areas of expertise sa mga subspecialists po. So in order to get into our way to the direction, there must be a parallel or complementation of the implementation of both the Philippine Health Facility Development Plan and also the National Health Workforce, or the National Human Resource for Health Master Plan. And this has been into the motion of getting into the implementation. However, there are intricacies right now that both the Bureau of Health Human Resource Development and the Health Facility Development is working out. So at this juncture, we would like to drive home the message that medical specialists are valuable nation builders and, in fact, catalysts in the health sector development of our country. Likewise, the medical specialty societies and subspecialty societies are partners and actors in making the universal healthcare a reality. So we see that a synergy of government and private sector engagement will complement this endeavor of our nation, that hopefully we can experience in our lifetime. And well, lastly, I'd like to close this presentation on a lighter note that this UHC dream is a collective endeavor. It's a bayanihan of its own, something that we can only be part of the journey towards our sustainable future. And I hope we'll be one in this together. So thank you very much for your kind attention. Over to you, Doc Carmela.
Dr. Agas.
Thank
Yes,
you.
Doc. Thank you very much. No, so I think that was very clear, no, and basic details, no, about the UHC law. I think we can start with the question and answer portion. Okay, so I think there's one question you'd like to initiate. So, can a general internal medicine specialist without subspecialization be qualified to provide specialty care in a level 3 health
Bagay sa'yo pa,
facility?
maganda. Pero maganda fit. Parang ang tinahi sa'yo eh.
Yes, Dr. Agas?
Hi, ma'am. Yes, yung question is on the
Yung general
general
internal medicine.
IM.
Opo,
Yeah.
yung tapos walang subspecialization siya. Qualified po ba siya to provide specialty care sa level 3 health facility?
Yeah. In level 3 health facility, we have multiple levels of MS, no, yung sa plantilla position. So sa general IM, usually MS 1 or 2. Yeah, so if ever there's an available plantilla position that general IM can do in a level 3 hospital, then probably that can be done. Ang kailangan, kasi ngayon, pinag-aaralan din po ng DOH-HRDB yung task shifting and task sharing. Kasi we noticed that there are gaps in the human resource complement in our hospitals, especially in level 3 and level 2 hospitals. So ngayon, if that's the parameter, if there are tasks in level 3 hospitals that a general IM can actually do, and meron siyang plantilla position for that, it's either MS1 or 2, then yes, that can be feasible po.
Dr. Carms, meron
Yes
lang
po,
ditong mga konting questions sa Q&A
Sige,
box.
Doc.
Dr. Quen, thank you
Okay.
so much for
Yes.
that. Actually, marami na naman akong na-pick up from the slide set. Kasi we're doing the caravan doctoral with the different chapters of PCP, and we're collecting talaga questions from the province. Like we've done it in Aklan, we've done it in Negros, we've done it in Pampanga, we've done it in Ilocos. So ang tanong nila lagi, doktora, is sino ba yung itatap namin so that we can be engaged or on board with the policies? Kasi ongoing daw yung ngayon yung phase 2 natin, doktora, di ba, for the integration. Sino daw po ba yung lalapitan ng mga medical organization para maging on board kami with the decision making, policy making, so that we can engage with them and collaborate? Kasi yun yung laging tinatanong nila, sino ba yung tao na kakausapin namin, i-address namin para makasama kami dun sa LGU integration.
Yeah. Yes, sir. Sa DOH po, ang Bureau handling integration is the Bureau of Local Health Systems Development. So it is under Dr. Lester Tan,
Okay.
Director Lester Tan. And also, the HHRDB under Director Johanna Banzon is also reaching out to specialty societies. Kasi right now, we're also engaging specialty societies and PMA actually for the residency training programs, and also in the primary care workers certification. So dalawang channel, PCP can tap on BLHSD, Bureau of Local Health Systems Development, and Bureau of Health Human Resource Development Bureau, HHRDB.
Actually, Doctor, in corollary to that, medyo kasi yun pala, iba palang bureau dapat yung na-invite for this question. Although this is very pertinent with the primary care. Kasi
yes,
Doctor, tinatanong niya, is how can DOH monitor if the LGU is technically capable of this adaptation of the new system? Feeling ko with that first question, I told you po, yung pwede. Although this is part still of the universal healthcare, but I guess separate division can answer this fully po siguro. No?
Yes.
Para may hit natin by 2029. Kasi with the, di ba, ang istorbong COVID-19 medyo gumulo sa ating sistema for quite a while, like 2 to 3 years. Sa tingin mo ba, Doktora, ma-hit natin yung target natin by 2029?
Okay. Just to be pragmatic about it, Doc, no, we encountered disruptions in our economy, and largely due to health emergencies, and that will be the first, I guess, that will disrupt in 2020. And looking into a 5-year trend of another disruption, and that will definitely have an impact in our implementation timeline. So in my view, it may not be fully implementable by 2029, but depending on the next administration's thrust or direction, that can be somehow be thought about. One thing is that when the Universal Healthcare Law was passed, it actually has the burden of us scrambling on the finances that it requires. Kasi mataas po ang requirement ng UHC implementation. In other countries, they spend billions, even trillion. And the paradigm shift from a curative health system to a promotive and preventive health system that will later on minimize health expenditure in the country, that will be, contributing to our GDP, is a matter of actually investment prioritization. So if the administration, it either current or the next administration will pour in budget for universal healthcare implementation, regardless if we are a health system that is devolved or decentralized, then I guess it can be implemented in the next, that's beyond 2030. That's being pragmatic about it, because we have to realize, and we have to be cognizant that after the 2020 pandemic, our national debt spiked, diba? So, and it keeps on piling right now. So, nagpa-pile up yung national debt natin, and we are searching for funds to finance our social services. Ang social services, hindi lang naman health. May housing, may education, merong arts and culture. So, marami po. And I think that's the major concern in the implementation of the law. Kasi pag wala tayong fuel, hindi tayo makakarating sa ating destination. So that's how we have that analogy. So if our vehicle for the universal healthcare law is the financing, that will determine actually how fast we can get there and how slow we can get there. You see, yung pag-enact pa nga po ng UHC law in the Philippines, inabot tayo ng 3 decades. Diba? So I guess we try to be realistic about it, while we have a constructivist attitude na yes, we will do this together, and incremental. So kahit na konti-konti nagagawa natin. So yun yung challenge ko ngayon, and I think sa slide na pinakita ko po sa inyo, 2029 yung projected, but the rate it's going right now, if magkakasundo po at ma-realign, may possibility na 2029 ma-achieve natin yon. But with the disruptions and possible disruptions in the next 3 years, that will spell another story. So may tayo, tinitingnan na margin of expansion sa implementation timelines, and that's where the DOH is now working on the amendments po doon sa provisions ng UHC law. Kasi may nakita tayo ngayon na hindi implementable, and we wanted to rectify that provision ng law. Ayun po.
Thank you, Doctor. Actually, meron akong tatlong very, very short lang na recurring question whenever we do the caravan. Doktora,
Yes.
pwede ito bang maging multiple hat ang ating internees? Pwede daw ba siyang mag-specialist habang nagpa-primary care, and paano daw kung hindi accredited yung healthcare provider pero member network yung member. So pwede daw ba siyang mapa-admit dun sa hospital na accredited pero hindi accredited yung kanyang doktor? Yun ang laging
Lalo
tinatanong
na,
ko.
Doc, no? Lalo na yung nasa private, no?
Yes,
Private,
lalo sa
Yes.
private
yeah.
sector. Oo.
Oo.
Matatakel po ba natin today yun?
Oo. Yung Doc, yung sa question on yung internist will be primary care provider
And specialist siya.
and specialist. Actually, may two hats kasi siya. Possible po yun.
Okay.
Kasi right now that we're transitioning, parang baby steps pa nga lang po tayo. We're just transitioning. Kailangan po natin yung specialist to do that role. So pwede siya maging primary care worker as navigator of patients, then pwede din siya mag-internist. So that can be sasaluin niya sa specialty care. But later on, pag halimbawa na meron ng
Establish.
say 5 years into the implementation, tapos unti-unting natatransition natin, later on, magde-decide na siya kung primary care ba ang gagampanan niya na role sa navigation natin, or internist as specialist. Ganun po. Tapos yung question po, doon sa yung
Accredited yung hospital, hindi accredited yung doctor na gusto nung member nung network na pasyente.
Ayun. So kailangan magka-catch up. Actually, sir, ang HHRDB working with PRC will catch up on that kasi ang goal natin is matulungan din yung mga specialist na maging accredited sila. So another division is in charge of that.
Ayun nga.
And yung details po kasi might be sila yung makakapagbigay ng expansive explanation po.
Actually, Doktor, kasi nakikita ko yung mga hospitals, kasi I belong also sa government, meron nang nag-visit na PRC representative and DOH. Ito ba yung JAW?
Yes, opo,
Ito
sir.
ba yung JAW? Oo,
Yes,
kasi
Doc.
parang kinukuha nila yung mga credentials namin.
Yes, Doc.
Opo.
Opo.
So is this part of the JAW?
Yes, sir. Part yan ng JAW. And since ang HHRDB is a lean team, isang team ang gumaganap po ng role na yan. So, ang ginagawa nila ngayon is nagtatap ng specialty societies. I'm sure itatap po kayo, sir, para halimbawa may mga ganyang ground feedback, kaagad-agad mabibigyan po kayo ng guidance and solution for that. Kasi pwedeng magbigay ng assistance ang DOH so that magkaroon ng accreditation din. That can be part of the conversation, I guess.
Dr. Gwen, yung kasing mga ibang question medyo mahaba dito sa chat. Can we just give it to you po? So that
sige, sir. Opo, Doc.
Kasi medyo mahaba yung concern nila. It's a multiple question eh.
Oo.
I think due to the interest of time. Ikaw, Carms, meron ka pa bang gustong itanong from your end?
Yata, pero actually the questions
medyo mahaba kasi, Carms, no? Yung
yes,
mga
tapos more or less the same.
Yeah.
Yung primary concern actually is more on the private sector.
Kasi
that's the doctors actually in the private sector are the ones that have really a lot of questions. No, like where do we fit in? No, how do we start if ever we are interested to go into primary care? And then how will it affect our practice as private practitioners? So parang ganun yung mga questions na pabalik-balik.
Although nabanggit na ni Dr. Gwen kanina kung anong division yung pupuntahan natin for, di ba, for collaboration, yung health human resource at saka isa pang doktora medyo mahaba yung sabi ko na lang yung recording kasi medyo mahaba yung division. So possibly yun yung mga pwede nating i-collaborate sa local level. Opo.
Tsaka, Doc, baka may questions din on financing.
Yes, yun nga, may mga financing nga, oo.
Yeah. Lalo na yung mga reimbursement. I think PhilHealth is the best office to respond to it. Kasi mabibigyan po kayo ng detail on the, for example, reimbursement. Kasi I heard also from the ground na both private po ito and public na may mga na-refuse or na-delay na mga reimbursement from PhilHealth. And then some doctors ayaw na nila magpa-accredit ngayon sa PhilHealth kasi nga na-delay or hindi na bigyan ng reimbursement. So that's something critical and crucial na pag-usapan po.
So ibang division kasi
parang
PhilHealth po
discouraging
kasi
siya,
yun.
no?
Yeah,
to
opo.
join yung konsulta package ng PhilHealth kung ganun yung feedback na you will get from other doctors.
Okay, so I'm
That's
giving
right.
the floor na kay Dr. Carms. Dr. Quen, nice meeting you po and thank you so much po.
Nice meeting you, sir. Thank you po.
Thank you, Quen. I came in late. Sorry.
Mama, Doc Imes, thank you. Thank
Ano ba
you
si
po.
Dr. Imes?
Ang busy sa ospital, grabe. I just finished signing documents. By the time I noticed it,
Ayun.
maganda naman ang feedback, Quen, sa lecture mo. Thank you, ha.
Thank you, ma'am.
So I think before we end this session, we'd like to present the certificate to Dr. Agas. So we'd like to present the certificate of appreciation to Dr. Quen Diana Agas as speaker for our webinar entitled ABCs of UHC. So this is a webinar of the basics of the UHC law. Today, March 22, 2023, and signed by our chair, Committee on UHC, Dr. Librado, the president of the Philippine College of Physicians, Dr. Diana Payawal, and of course, our region champion for the Committee on UHC, Dr. Regina P. Barba. So thank you again, Dr. Agas, for spending some time with us. For our attendees, this is just a prelude. So please do attend our upcoming UHC Summit this Saturday. And to give us our closing remarks, we would like to call on Dr. Dax Ronald Librado, the chair on the Committee on UHC.
Thank you very much, Carmela, for giving a very good moderator to Dr. Quen Raagas. So the UHC committee extends its appreciation to our speaker, Dr. Quen Raagas, for giving us the time to provide us on the understanding of the UHC law and how we contribute to the process of restructuring the healthcare system in our country. As a regular webinar series of the UHC committee, this webinar will now provide the impetus of information for this Saturday, March 25, the Philippine College of Physicians IM Summit. May I invite you and your colleagues to be in attendance at this activity online as we provide the proper dialogue and discourse on the impact of universal healthcare in our practice. So this webinar has a corresponding CPD units, and I hope to see you this Saturday, and thank you for attending this webinar.
The Philippine College of Physicians.
Sorry, Dax.
The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine. Real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month, on the third leg of its pre-convention series of activities. The PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College